Mr. President, we're still dealing with some of the same issues we dealt with before. It's interesting to me the number of people that have said, is Congress obsessed right now with all the press reports on all the things that are happening around the presidency and everything else? And I've said to them, no, that is one of the things on our list, but that's not what we're talking about the most. We're working on issues like tax reform and healthcare issues, regulatory issues. I just had 3 bills that went through the markup process just yesterday dealing with small business regulation and how we're going to be able to manage getting things back in order. We spent all day at lunch on Tuesday. We spent all day at lunch on Wednesday with our entire conference doing a working lunch together talking about healthcare policies. We're still working on trying to finish these issues that absolutely need to be done. Healthcare is one of those issues that has been one of the prime conversations now for years. And we're in the final stretch of actually working through an actual repeal and replace of multiple sections of the Affordable Care Act that have caused the greatest amount of damage. But I still have people that will catch me and say, well, there are beneficial parts. What are you going to keep and what's going to go? And why do we need to replace it? And I'll typically smile at folks and say, well, let me give you a quick recap on why we need to replace this and what's really happening. And it may be different in your state than it is in mine, but let me lay it out where we are and what has been said. Remember back in the earliest days, the Affordable Care Act being passed, it was all about premiums will decrease. In my state, premiums went up just last year, 1 year, 76% in the individual market. 1 year increase, 76%. The year before, under the Affordable Care Act, they went up 35% in 1 year. Premiums not only did not stabilize, they've accelerated out of control. This was all about deductibles will decrease. Deductibles have also skyrocketed. It was about if you like your doctor or if you like your health care, you can keep it. Doctors have moved into other hospitals. Doctors' offices have stopped being independent. They have to be able to work for other facilities to be able to maintain the compliance requirements there. So most of the independent doctors in Oklahoma no longer are independent doctors. They now work under a corporate structure or they cannot survive. And this whole thing about competition on the open market. We used to have multiple companies in Oklahoma that provided insurance. We now have one. Every other company has left. One company left. There is no competition driving down prices. It's a monopoly. And it's the same thing happening all over the country. Just this year, now a third of the counties in America only have one insurance provider. And in my state, all 77 counties only have one insurance provider. To tell you where things are really headed on this area of competition, United, which is one of the largest providers of healthcare, dropped out of all the exchanges nationwide, everything. They're doing none. In the past couple of days, Aetna just announced they will no longer do competition in any state, anywhere in the country. The number of companies that are even willing to try to live up to these regulations continue to drop off. That's what's really happening in our state. If you want to know what that actually means to real families, let me give you a taste of what comes into my office in a regular time period. Because I have lots of people call my office and say, protect this, protect whatever it may be in the healthcare coverage. You've got to make sure you guard it. And I typically will say to them, let me introduce you to some other people that are also calling in and are also writing in. I'll leave their names out, but let me give you just some of the situations. A single mom that has children from Norman, Oklahoma, contacted us and said this, that her family have seen their premiums triple over the last 2 years. Currently, their premiums are $1,500 a month with a deductible for their family of $24,000. Another family contacted me that has a disabled child. Their federally mandated health insurance under Obamacare for 2016 was $895. For 2017, $1,553 a month for this family with a disabled child. A husband and wife in Tulsa, Oklahoma, they wrote me and they said this, their current monthly expense for just insurance is $1,500 a month, twice the amount of their house payment. They have a relative that is working 3 part-time jobs because they can't get a full-time job because under Obamacare, a full-time job also requires all the benefits. and no one is hiring in that full-time area because of the additional requirements that are on from Obamacare. So they're working 3 part-time jobs, and because they're working 3 part-time jobs, they have no health insurance. They're also paying the penalty fine on their taxes for not having insurance. So not only can they not get a full-time job because of the Obamacare requirements, they're paying a penalty because of it as well. A husband and a wife from Newkirk, Oklahoma wrote me. They said for their insurance alone, not including out-of-pocket medical expenses, the husband and wife will spend $21,965 this year on health care coverage. Another family wrote me from Stillwater, Oklahoma, and said that their health care coverage used to be 5% of their family income. Now their health care coverage is 22% of their family health care income. I have another family that wrote me, and it was very interesting. They're from Oklahoma City, and they wrote me and they just gave me a breakout, a chart that they had created. In 2015, their monthly premium had skyrocketed to $1,400. In 2016, it was $1,500. In 2017, now it's $2,042 a month. A month. Let that soak in for a moment. Then they made this statement. There are financially strapped families that won't go to the doctor due to this out-of-pocket expense. That's the additional deductible that's on top of their $2,000 premium. Individuals buying private insurance have no recourse because we have no other option that we're allowed to go to. There's only one insurance provider available to us. We need competition in this state to take away the financial burden on our families. All they want is options. But right now what the federal government has told them is, no, we have a policy that you have to buy that policy, and if you don't buy the policy that we pick for you, we will fine you on your taxes. They're stuck. Thousands of Oklahomans are stuck. Why is this such a big issue? Because of how it affects individuals. Why is it such a big issue? Because of what is still coming. There's this false belief that the Affordable Care Act is fully implemented. That's not true. Many of the aspects that are the most onerous parts of the Affordable Care Act did not go into implementation until after President Obama left office. Let me give you some examples of some things they backloaded that wouldn't start until after he leaves office. The Cadillac tax. Every union family across the country will start to face much higher costs on their insurance because their insurance is considered too good under the Affordable Care Act. So all those great union families that have great health care insurance across the country are about to start facing additional taxes and fees for their insurance being better than their next door neighbor's insurance, as the Affordable Care Act tried to push down health care insurance to be the same for everyone. There's increased penalties that are still coming because the full penalties haven't been rolled out yet on all the taxes. They've gone up a little bit each year. They accelerate now in the next several years. There's increased taxes. The medical device tax that's sitting out there has been delayed, but it now will go into full implementation. There's also a tax that's a health insurer tax that adds an additional tax to every insurance company that, of course, they will then pass on to every single premium. There's still all the costs that are associated with the expansion of Medicaid. Now, there's been a lot of conversation about the expansion of Medicaid. As many people know, this was an expansion of Medicaid for people from 100% of poverty to 138% of poverty. It's just that small bracket that there had been expansion of Medicaid. Initially, the federal government covered all the costs of that expansion, and then starting this year, states start picking up the additional cost. My state, like several others, chose not to do the expansion. And my state legislature and my governor has taken a lot of heat for that. But what they said several years ago is, once the state has to pick up the additional bill, we will not be able to afford that expansion. We can't do that. Let me tell you what that would be in my state. Because we didn't expand, we don't have an additional cost this year, but let me give you a parallel. The state of Oregon is almost exactly the same size as the population of the state of Oklahoma. They will now start taking on an additional $257 million a year in their state budget because of the expansion of Medicaid that they took on. Now, that may not seem like a big deal to some people in this chamber, but in my state right now, our state legislature and our governor is struggling to be able to balance a budget, and we're going through all kinds of issues because right now our state is about $800 million behind budget, after last year of also being $800 million. So if the people in my state could imagine what's going on right now at the state capitol, thinking that if we had an additional $257 million added to that hole, that's what it would mean for our state. There are real effects that are out there. And I understand healthcare is extremely personal. That's why it's always been something that's been decided by individual families, not by the federal government, and in my state, someone 1,000 miles away trying to make healthcare decisions for them. What we're really trying to do with this is to try to deal with the issues I just laid out. This is not about partisan politics. This is about people and families that have been hurt by what's happening in the Affordable Care Act, by someone 1,000 miles away trying to tell them what policy they can and can't buy, by the skyrocketing cost, by the actual effect that has happened. And while I have some people say that's not real, I could line up the families in my state that used to have coverage that no longer have coverage because they can't afford it anymore. And the simplistic answers of just, why don't we just cover everybody in the country? Why don't we just do a single payer system? People don't understand. They know how bad it's become now and how hard it's become now. You would accelerate that multiple fold if you just slip into a single payer system. What do we need to do? Well, let me give you a couple quick thoughts. We're going to need transition time. Whatever you hear about all of the conversation that we have about the Affordable Care Act and replacing the Affordable Care Act, please know that all of the conversations for us begin with how do we do a good transition from where we are now to where we need to be. I have folks say, will next week this end? Will next year this suddenly goes away? No, there'll have to be a transition process, and it'll be over several years. We're also still looking at some of the most basic elements. For instance, I've had folks say, my kids, I want to be able to keep them on my insurance till 26. That's been assumed, quite frankly, by the House and by the Senate. What the House already passed already keeps that. There's been a lot of conversation about pre-existing conditions. Most of the conversation we have had as a Senate behind closed doors is about taking care of people with pre-existing conditions. Those are very real issues. We understand the dynamic of what happens back and forth with insurance companies and families and the struggles that families have if they're cancer patients, diabetics, rare blood diseases, Alzheimer's, so many struggles that are out there. We get that. That's in our conversation as well. But we've got to be able to find practical ways to be able to start leveling out the cost of insurance. We can't survive with rates skyrocketing like they are. And people need to know that are in the safety net's going to actually be there. We've got to resolve these issues. We've got to work for the benefit of our states that can't afford these overwhelming cost increases. We've got to work for the benefit of families that are facing the issue, and quite frankly, for the federal taxpayer as well. While my state struggles with an $800 million hole that they're facing right now in the budget, by the end of our session, they will have that resolved. They're constitutionally required to have that resolved. In the federal government, we're facing a $20 trillion budget hole right now. $20 trillion. And for all the folks that say, just add more to it, it'll be fine, may I remind you, there is a day all that has to be paid. We've got to be able to be responsible with our federal budget. At the same time, we're helping our states be able to manage theirs. At the same time, we're helping our families. No, this is not simple, but it has to be done. We've got to find a way to be able to restore it. This is not about returning healthcare back to where we were years ago. That, quite frankly, is gone. As I mentioned before, all those private doctors that used to function in my state, they don't function in my state anymore. They're all under corporate structures. The insurance companies have left or have merged. Hospitals in my state have merged because they couldn't survive the last few years of Obamacare. The healthcare, even if we wanted to go back to how it was, and we don't, even if we wanted to, we can't, because there's been so much change in the last few years. But we have to be able to actually fix where we are. So I would encourage continued communication. Lots of folks have contacted my office on every side of this issue. Keep doing that. Lots of folks in this chamber have had dialogue. And though it looks like a partisan exercise, it's actually a pretty open conversation among our conference to try to figure out how are we going to actually help families, help our states, help our federal budget, and help us to be sustainable in these critical issues. I've got lots of other letters I can bring. There's lots of other stories out there. But I think we know enough to be able to know this is something that needs to be done. So while the nation gets distracted, we cannot. Let's finish the healthcare conversation. Lots of families are counting on us. With that, Mr. President, I yield back.